My name is Judy Murphy, and I had my surgery on December 9th.
And I'm Lisa, her daughter, and I'm in town to help her with her recovery.
I went into my closet to hang something up, and I lost my balance, and I just fell over onto my right side. I couldn't walk or anything. I went into the hospital, and they found out I had fractured my pelvis. It changed my whole life because I live independently. Now I have to have caregivers, I have to have occupational therapy, physical therapy.
My name is Dr. Robert Swift. I'm an orthopedic surgeon here in Naples, Florida, and I started using the iFuse implant to improve the quality of care to my patients and improve early mobility. Many patients with sacral insufficiency fractures have significant pain and disability. They are often bedridden, treated in the hospital with narcotics and attempted physical therapy. Because of this, I started using the iFuse implant, and I noticed immediate improvement in patients' pain, their ability to mobilize. So I saw Judy in the hospital as a consult. She had fallen and she couldn't weight bear or stand. I made sure we got a CT scan, and looking at her CT scan, she did have a pubic rami fracture, but she also had sacral fractures, which gave her an unstable pelvis. I spoke with her and her family at that point and discussed fixating her fractures using the iFuse TORQ implant.
And the reason that I did this surgery was that one of my sons talked to Dr. Swift, and they explained about the whole operation, and I said, I think we should do this surgery, and he agreed, and that's when we decided to do the surgery. I really didn't have any concerns. I just figured that this was the best thing for me to do.
Well, Judy's workup was pretty much done in the ED. The only thing that we added was a pelvic CT scan. And I think when you get hip films or pelvic films, if you see a pubic rami fracture, I think it's important to get a CT scan. CT scans will show, a sacral fracture. If you appreciate all the ligaments that surround the pelvis, once there's a fracture there, those ligaments are disrupted. So it takes a long time for those to heal. And I think the procedure speeds that recovery and allows stabilization of the pelvis so people can get ambulatory.
I'm doing very well. I'm able to walk with the walker, and if I hadn't had the surgery, I wouldn't be able to. I understand that if you just break your pelvis and don't do anything, that there's nothing but you have to wait while it heals, and it's very painful. So the surgery was the best thing I could have had done. I'm feeling a lot more independent, and I'm doing exercises at home. My recovery is coming along. It's going to take a while, but it's coming. And as I say, if I hadn't had the surgery, I wouldn't have recovered this fast, so it's doing very well.
So after the procedure, she had some postoperative pain, but she was able to mobilize relatively quickly. She was up walking 2 or 3 days. She was able then to go to a postoperative rehab center and gradually get back to independent ambulation with a walker. Well, Judy now, she's happy. She's not on any narcotic medications. She's wheeling around in her walker. She's highly functional. She's enjoying time with her family. Using the iFuse TORQ implant gives us the opportunity to stabilize the pelvis, create early mobilization, and improves people's medical conditions and functionality.